So this is a follow-up video to inform you how I have been doing since my first PRP treatment from Alliance Regen and Rehab. So I went in for a follow-up yesterday and it went really well. I've added a few before and after pictures of my right and left TFCC in the video for you to see. So he says that there's still work to do and I definitely need more treatment, but I'm definitely getting where I'm supposed to be, and it's definitely helped with my overall functioning. I'm able to do more without pain, and some of the activities that I've been able to do are get more out of visits with the dog I had to rehome. That particular animal could not come with me when I moved, so yeah, I really enjoyed being able to have more out of my visit because I travel whenever I can to go see him. The other thing that I've been able to enjoy more is art, painting, drawing. A little bit about me: I grew up in a family of artists, but I wasn't really able to further my artistry skills because I've been in pain, I've been sick, so I haven't really had the stamina to put to it. And when I have forced myself in the past, it's not been enjoyable. So I have started to actually enjoy working with the skills I do have. So that's nice. It's a huge outlet for me. I usually do art to give as gifts, but it also just being creative helps with your mental health. So it helps me deal with some of the emotional stress of dealing with a chronic illness. So the more I can do, the better, honestly. I've also been able to do more social activities with the young adult group in my church. Game nights, sport events. I think we went mini golfing earlier in the year, and then we swim quite a bit during the summer. We did volunteer work. We have gone to hospitals to sing for patients. That was great, and we went to a park and handed out food and cold water for the homeless. So that was a real privilege. When you're managing a condition with multiple components, it can be exhausting, and sometimes you just don't have the social energy to spare. So that's been important. And then my favorite thing right now, at the moment, is there is this individual from Norway who's been going to the same school as me, and he's leaving in a few weeks. But he pulled me into bouldering, and I was always a bit of a monkey as a child, so it just has made me so happy. So I've picked up bouldering, and I'm able to, as long as I'm really super careful, get a lot out of that. And that particularly is working a lot of the small muscles that I have a hard time working out on my own normally, because you have to use those muscles in your fingers and around your joints in order to climb and stabilize. So it's actually really wonderful. The things I've been doing in addition after the PRP has been a lot of physical therapy and some personal training. I actually need help exercising effectively without hyperextending something, tearing it, or overdoing myself and making it worse. So there is a small amount of exercising I do on my own, but for some of the major muscle building, that is something I need help with, because I'm just easily, and that comes out of pocket, of course. And I've had some friends who have been helping me financially, but it is really hard to keep up with. We're working hard, really pushing it, and my quality of life is improving. So please enjoy the video.
Okay, so as we discussed, with EDS, your collagen, the connective tissue, doesn't grow or doesn't repair strong tissue. So we use dextrose or PRP with the growth factors from your blood to stimulate this collagen, make it stronger, and then you have better movement and less pain. So when you were here before we did the treatment, go ahead and push up. When I did this, checking your cuff, you were very weak, and now it's very strong. So that shows that we've got some stability, and you're able to activate your muscles and not have it break down to force due to the weakness in the ligaments. And when I'm doing, checking your labrum here, so push straight up, that's pretty rock solid. So that fell the first time. Same thing on this side. Push straight up, that's very strong. So what that's telling me is that you have some improved tissue integrity in that labrum and in the capsule, and as well as the rotator cuff. So we're going in the right direction, and we're going to do this some more to get you better and stronger in the neck, in the low back, in your hips, and in your wrists. And then that's going to be able to give you a better lifestyle and not have to be tied to going to doctors all the time. You can actually get out and do the bouldering and everything else you want to do. Okay. Sounds good?
Yes, that's great.
Left. So this is your TFCC ligament, and this is today's evaluation. So we can see there's still a little bit of softness and small tears in here, but it's greatly improved after the PRP treatments. And so we're getting this tissue, this connective tissue, stronger, and you're feeling that, and you're able to do much more because of that, and the pain has subsided. We have still a little bit of work left to do, but we're going in the right direction very well.